I'd like to use these for further education on some of the blogs and websites I'm part of, and help further quell any fears of any future open heart surgery patients. Thanks for your understanding. I appreciate it. This is an echo of my valve several months before surgery. The very white bottom half of the valve should not be there, as well as the piece that comes off of that valve at 45 degrees. The doctors at Cleveland Clinic felt like that this was a very serious infection, but during surgery they found that it was actually just a monocuspid valve.
I'm fine.
My second night in the ICU, I went into AFib and tachycardia with pulse rates in the 200s. You'll see slides of my EKG, my heart monitor, as well as the medicines that they used to try to get me out of it. After 2 days with medicine, they were unable to get me out, and they had to do a cardioversion or an electric shock. There's also a slide showing the paddles they used to do that. biggest fear after surgery was waking up on a ventilator as well as all of the tubes that were going to be coming out of it. I did wake up and was conscious with the ventilator in and out of consciousness about 2 hours. I was actually at peace with that, and it was relatively easy removing it. The different tubes that were coming out of me, I had a swan catheter in my neck that went down into my heart, taking different measurements, as well as a port for medication in and out of my neck and blood. They also had 2 chest tubes that came out of my right side. They removed the first one the first day, and the second one they removed after 7 days. The second chest tube was extremely painful being removed. They also had 2 pacer wires that came out of the bottom of my sternum, very thin wires that were stitched to my heart, and they needed them to hook me to a pacemaker at one point. Those were not painful at all being removed.
Hello everybody, it's my 4th day after aortic valve replacement. Things are going well. Still in ICU, just having some AFib issues. We were able to do a cardioversion and get me out, so I'm in good shape. A week ago today, I was down in the waiting room getting ready for my open heart surgery to replace my aortic valve and do an aortoplasty. Here I am today talking about potentially getting dismissed, walking lots. Everything's going really well. I appreciate everybody's support. Thank you.